All right, we are good to go.
Okay. So I want.
Charlotte, do I make you or?
Yes.
Yeah, make Charlotte the host,
then
and she can make us both co-hosts.
Yep.
Okay.
And then Carmen's joining, and then I'll assign her the captioning.
Right on. We're right on time.
Okay, David, you and Betsy should be co-hosts, and then Carmen, I believe I've assigned for captioning.
You have, and I can see her subtitles right now, so we are in good shape.
Okay, I'm just going to go ahead and start recording for my own purposes, so I just know not to forget that.
Yep, I'm going to go mute.
And I just saw the captions on YouTube, so we are good as well.
Great.
Awesome.
We'll just get started a little bit. 9:53 now, so in about 7 minutes or so.
Good morning.
Good morning. Bev, can we circle up this afternoon?
Yeah, I have a meeting. I have a meeting later. We can talk. Sure.
Okay. Do you want to just give me a call? I have something from 1 to 2.
Me too.
And that's it.
Me too. I have another meeting,
Okay.
but I'll be back. But can we talk by phone?
Yeah, just give me a call. Mm-hmm. Good morning, Carla. We're waiting for everyone to join, and then we'll get started.
My room is so dark. Ugh.
Looks like there's ambiance.
You think?
Yeah.
Okay.
For those watching the YouTube, we're waiting for our members to join and then we'll get started. Good morning, Erica. Hi, Erica.
Hi, Charlotte. Let's see. I'm not seeing others.
Are you in full screen?
I was, now I just see myself. Let's see.
I think if you go to participants, you can manage.
Okay,
You click that and then you can do like a view, different views, whether it looks like the tic-tac-toe or,
yeah.
I don't know. We're still waiting for the rest of the committee to join.
Okay.
For those watching the YouTube, we'll get started shortly. We're just waiting for the rest of the commission members to join. The committee members.
So how's the weather where you all are?
It's cold. Well, I went out for a walk and it was freezing.
You have snow?
No, but it sure felt like it.
Yeah.
Still
in
snowing
Richmond.
a little bit here.
Is
Yeah,
it?
I'm in Richmond. It snowed here.
Really?
Yeah.
Yes.
Mhm.
It's snowing in Williamsburg.
Uh-oh, I wonder if we'll get it up there in Arlington. Maybe so. It's probably pretty.
It really is. You need the same.
Good morning, Charlotte.
Good morning, Diana. How are you? We're good. Just wait one moment. There's Harvey. I think you're muted.
I did this. I've been doing this the whole time. I've been talking and been muted. I do apologize. I was on a 10 o'clock call, 9 o'clock call, and I said, I got to go. I have another meeting. So hello, everyone.
No worries. Okay, I think everyone's here, so we'll go ahead and get started. Okay, welcome everyone to the Nutrition Special Committee of the Commonwealth Council on Aging. Due to the active state of emergency, this is an electronic meeting pursuant to item 4-0.01 of the 2020 Appropriation Act. Meeting notice has been provided. The meeting is being recorded and minutes are being taken. All votes will be conducted via a roll call of voting members. Meeting materials are posted under the Council on Aging's webpage at the link posted in the slide. Members of the public are able to join the live stream via the DAR's YouTube page. Please be advised if the live stream is interrupted, we will need to pause the meeting until it is restored. Public comment will be accepted by email or phone to my attention. Public comments that were received by December 4th will be read, or if lengthy, summarized during the meeting when we reach that agenda item. If you're a member of the public and would like the forum to provide public comment on the technology and functionality of today's virtual meeting, please email me. Working through the Zoom functions, members, please keep your microphone on mute unless you're speaking. This helps reduce background noise. Also, before you speak, please state your name. Not only does this help your colleagues on the committee know who is talking, but it also helps Cecily with documenting the minutes. This is particularly important as committee members will be discussing recommendations and our captioner will be trying to caption the discussion. Members, if you have your video enabled, please be aware that the system may capture your image and video in the public streaming and in the Zoom recording. You can use the chat feature as well. That is being monitored by me and to the degree feasible, also our colleague David. If you would like to view the real-time captioning of today's meeting, please click on the CC button on the menu bar at the bottom to show subtitles. Zoom participants will have to turn on closed captioning. The YouTube streaming will automatically include the captioning. View options in this area you can set yourself, and some features will be set by the host. Lastly, I'd like to thank the DARS video teleconferencing team and the DARS communication team for making the electronic meeting possible. I'd like to welcome you all to the meeting today. At this time, I will conduct a roll call for the committee members to determine if a quorum is present for today's meeting. At this time, just indicate your presence and then we'll do introductions in a moment. Harvey Chambers.
I'm here.
Great. Carla Hesseltine.
Here.
Diana Pagawa. Here she comes.
Here. Sorry.
Erica Wood
Here.
and Beverly Sobel.
Here.
At this time, when your name is called, if you'd like to introduce yourself, please do so. We'll go back through in alphabetical order. Harvey Chambers.
Hello, good morning, everyone. I'm Harvey Chambers. I'm a community relations consultant with Anthem Health Keepers Plus and also a certified senior advisor. And I've worked with the older adult population for years. I was a caregiver for my mother who had dementia of the Alzheimer's type. And so I'm passionate about that. And I'm really joining this because of the food insecurity and the things that we are starting to see that are happening in the communities and just seeing how we can work to address some of those issues with nutrition and that. So thank you. It's nice to meet everyone again.
Thank you, Harvey. Carla Hesseltine.
Hi, I'm Carla Hesseltine. I live in Virginia Beach, Virginia, although I'm in Richmond today enjoying a little bit of the snow. I am an elder rights activist as well as on the Human Rights Commission in Virginia Beach and also helping to care for an elderly mother. And certainly this has been a big topic for us this year as she's had some difficulties. So I'm just looking forward to getting to know everybody and being able to contribute where I can. Thanks.
Thank you. Diana Pagawa.
My name is Diana Pawaga. I am a health insurance broker. I have been selling Medicare plans for the last 15 years. And I am here because I really care about, I see a lot of food insecurities going on right now, especially with the elder population. And I am also a member of the advisory board of Salvation Army. So I am in my second term for the Commonwealth Council on Aging. Thank you.
Thank you. Erica Wood.
Yes, this is Erica Wood. I'm in Arlington, recently retired from working many years in law and aging. I'm chairing the council's legislative committee, and in that capacity have long been aware of this food insecurity issue, and so I'm glad that we're focusing on it.
Great, thank you. And Beverly Sobel.
Yes, I'm Beverly Sobel, and I'm chair of the Commonwealth Council and ex officio member today. And I'm really pleased that we are meeting because this was a recommendation from the council, and I appreciate the participation of everybody on this task force.
Thank you, Beverly. We also have some DARS staff here today. I'm going to ask them to introduce themselves. First, we'll have Kelly Wright.
Good morning, and thank you very much for this opportunity today. I am a registered dietitian and the nutrition program coordinator for DARS. And I look forward to speaking later about nutrition programs in Virginia.
Thank you. Kathy Miller, would you like to introduce yourself?
Yes, good morning. I'm Kathy Miller. I'm the Director of Aging Programs and Services at DARS, and I'm also a registered nurse. So I'm glad to be able to join your committee meeting this morning. Thank you.
Thank you, Kathy. Cecily, are you able to speak? Might be muted. We also, I think,
Can you
have
hear me?
Oh, yes.
Oh, okay. Hi, Cecily Slazer. I am.
Oh, you're coming in and out.
Okay. I'm an administrative assistant here at DARS in my 28th year. So I provide a lot of program support and support to our 3 aging boards.
Great. Thank you, Cecily. Okay, you should have the proposed agenda in front of you or as a handout. And at this time, we need to approve the agenda. Does anyone have anything they would like to add to the agenda, or is there a motion to approve the agenda as presented?
I move to approve the agenda.
I second.
Okay. Is there any further discussion? Hearing none, we'll do a roll call vote. Harvey Chambers,
Aye.
Carla.
Aye.
I'm gonna switch to first names. Diana,
Aye.
Erica,
Aye.
and Beverly.
Aye.
The motion passes, the agenda is adopted. We now need to conduct an election for a chair of the committee. I would like to open the nominations from the floor. Any member can bring forth a nomination. A nomination can be for himself or herself or for another person. The nominee must consent to the nomination. Are there any nominations? I promise I'll make it very easy for the chair. So I don't think Beverly can chair it because she's ex officio. So that leaves 4 other options.
And I would just like to say that since I chair the legislative committee and that's quite time consuming, I'm probably not able to do this.
If it is easy, I do it.
It's easy.
Mhm.
Thank you,
Alright.
Diana, because I'm new to the committee, so, and to the council, so I really would like to see how everything works first.
Yeah, I agree. Thank you, Diana. I'm in the same boat. I just felt I was too new to chair a committee this
Thank you.
quickly.
Thank you, Diana.
All right. I'm assuming there's consent to close the nominations. So we will be conducting a roll call vote for Diana as chair of the committee. Harvey Chambers,
Aye.
Carla, sorry, I'm gonna do first names again.
Aye.
Diana,
Aye.
Erica,
Aye.
and Beverly.
Aye.
Great. So I can confirm that Diana will serve as the chair of the committee. Diana, I'm still going to kind of lead probably this meeting to a degree, and then we'll connect up after the meeting on what the next steps are. At this time, we've reached public comment period. Public comment was accepted by email or phone. And public comments that were received by December 4th would be read during the meeting. And I can report that we did not receive any public comments for today's meeting. At this time, we're going to hear from Kelly Wright, who's the DARS Nutrition Program Coordinator, and she'll be presenting on DARS and Virginia nutrition programs. So I'm going to stop sharing my screen, and she will be able to share her screen.
Thank you, Charlotte. Does my screen come up? Oh, there it is. Let's see. There we go.
Yes. Can you all see her screen?
Yes.
Okay.
Yes.
Yes. Yes.
Great. So again, good morning. As mentioned, I am the registered dietitian with the Office of Aging Services and the Division for Community Living. And today I'm going to just review some of the nutrition programs in Virginia. And the whole goal of my presentation is to show how it aligns with the recently released Virginia's Roadmap to End Hunger. So I will keep referring back to that at times. So senior hunger in the United States, according to Feeding America's The State of Senior Hunger, 5.3 million seniors, or 7.3% of the senior population, were food insecure in 2018. The U.S. Department of Agriculture defines food insecurity as a lack of consistent access to enough food for an active, healthy lifestyle. According to Feeding America's Map of the Meal Gap report, the best available approximation of food insecurity prevalence, 842,870 Virginians experienced food insecurity in 2018. So looking at Virginia specifically, 69.4% of Virginia households said it was often or sometimes true that they were worried whether their food would run out before they had money to buy more. So there was 4.8 seniors that were food insecure, which is a risk of hunger. And there was 2.6 additional that were facing hunger and had a very low food security. And as you can understand, this is expected to rise due to COVID and has risen. So senior hunger in Virginia, Feeding America estimates that additional 447,000 Virginians will experience food insecurity in 2020 as a result of the pandemic. This is increasing the Commonwealth's food insecurity rate by 5.2% from about 10% to 15%. In addition to this, Virginia's senior population is expected to double by 2030, which means our public safety net and service delivery systems will need to grow and become more responsive to the unique needs of seniors that are food insecure and all seniors and Virginians. Food insecure seniors are 2.33 times more likely to report being in poor or fair health compared to food secure seniors, which is understandable and common. And according to Virginia's Roadmap to End Hunger, this is more than double the rate of food secure seniors. So for example, food insecure adults report greater difficulty affording a diabetic diet and lower abilities to address issues related to diabetes as compared to their counterparts that are food secure. So what does this mean for senior health? Reduced intake of calories and nutrients means there's an increased risk of malnutrition, chronic disease, depression, increased risk for activities of daily living, and increased healthcare expenditures. These multiple chronic health conditions can reduce a person's ability to bathe or dress themselves or to shop or prepare meals. Health, functional, and income limitations may lead to coping strategies such as eating less food or the wrong kinds of food, or making trade-offs between buying food and medications or seeing the doctor. In turn, these poorer health outcomes may increase healthcare expenditures and the risk of long-term care facility placement. So malnutrition, that's the lack of proper nutrition caused by not having enough to eat, not eating enough foods or eating the right foods, or being unable to utilize the food that a person does eat. Malnutrition is often caused by a combination of physical, social, and psychological issues. Several health conditions impact malnutrition, such as swallowing issues, multiple prescriptions, and cognitive impairments. Many seniors are on restricted diets, they have limited income, reduced social contact, especially now, live alone, suffer from depression, and in many instances, there's issues of alcoholism. So some of the federal nutrition programs that I'm going to discuss today are the two biggies in my life that are funded through the Older Americans Act, and that's the Congregate Meal Program and the Home Delivered Meal Program. The United States Department of Agriculture, the USDA, also has the Senior Farmers Market Nutrition Program, which is also very near and dear to my heart. The Supplemental Nutrition Program, also known Nutrition Assistance Program, also known as SNAP. The Commodity Supplemental Food Program, the Child and Adult Care Food Program, and the Emergency Food Assistance Program. There are several federal nutrition assistance programs that all address hunger and malnutrition. And it's the Department of Health and Human Services that fund the OAA Congregate and Home Delivered Meals programs. So the purpose of the Older American Act meal programs is to help people remain in their homes. They fund nutrition services through the Congregate and Home Delivered programs to reduce food insecurity, promote socialization, and promote the health and well-being and delay adverse health conditions of our seniors. So congregate meals, just a quick overview. These meals are offered in a group setting. They provide 1/3 of the dietary reference intakes, and they meet the dietary guidelines for Americans. They provide socialization, exercise, and other activities. Nutrition screening is conducted prior to entering into the programs, plus nutrition education and counseling is provided throughout. And anyone who is 60 and over and the greatest social and economic need qualify for the program. And so the Older Americans Act Home Delivered Meal Program, meals are delivered to homebound seniors. They again provide their same dietary recommended guidelines. This provides a safety check to our seniors at home. the same nutrition screening and education, and same 60 and older greatest social and economic need. Homebound is defined as someone unable to leave the home to attend regular social activities. They may be able to go to regular medical appointments, but need an escort or assistance to do so safely. The person is without access to adequate nutrition and for whom transportation to a congregate site is not feasible. The person must be able to prepare meals and must be unable to prepare meals and have no one available to prepare meals for them. And now here we are with these programs during COVID. The congregate and home delivered meal programs pivoted very quickly in response to this pandemic. Congregate sites were closed and the AAAs, the Area Agencies on Aging, ramped up their home delivered meal programs to keep everyone safe in their homes. And just to give you a little snapshot, over 2 million home delivered meals were served in fiscal year 2020, which is a 34% increase compared to last year. And then 14,413 people were served. During the pandemic, DARS conducted frequent surveys of the AAAs to stay abreast to the rapidly evolving crises. Over 90% of the AAAs transferred their congregate participants to home delivered meals within 2 weeks in late March. A few programs went to a virtual platform where congregate meal participants picked up their meal curbside. And this slide just shows our communication with the AAAs and how quickly everyone pivoted to closed congregate meals in late March. So as I mentioned, all participants are screened nutritionally, and this snapshot is fairly telling that I wanted to show. Basically, we have 10 questions that we ask the participants entering into the program. And what this shows, the highlighted in yellow is every single question, there was an increase to the number of participants that were struggling in this department. The only one, ironically, that did not have an increase is those that have 3 or more drinks of alcohol every day. But this true snapshot shows that, like for question 6, I don't always have enough money to buy the food I need. There was a 7% increase just from one year to this year with the pandemic. Another reason DARS surveyed the 25 AAAs was to leverage resources as supplies became scarce. You know, we had the FFCRA, the Families First Coronavirus Recovery Act money, and the CARES Act money, and DARS was one of the first in the nation to quickly move that money out to the AAAs so they could respond to this emergency. And DARS was able to see who was still struggling and who needed supplies and leverage those resources. So as I mentioned, we're going to roll into also aligning what we do now into the Virginia's Roadmap to End Hunger. A few of the roadmap's greatest opportunities to reduce food insecurity in Virginia over the next 5 years include several topics that we can help facilitate. So our Older Americans Act nutrition programs align with the roadmap. So we reduce hunger, food insecurity, and malnutrition. OAA promotes socialization and promotes the health and well-being of seniors, where the roadmap wants to maximize federal nutrition program participation and access and invest in strong food systems and empower local communities. So how can our home delivered meal programs align with one of the roadmap's objectives? One of the objectives is home delivered meals for seniors and people living with a disability will be provided as a Medicaid covered service. So that is just something to keep in mind, is how can we align with that? One of the barriers that I know of right away is meal providers cannot solicit program income or voluntary donations from Medicaid eligible participants, whereas the Older American Act programs allow and there's provided with some voluntary contributions. So the Older Americans Act and DARS nutrition education can align with the roadmap. The roadmap says that evidence-based nutrition education programming will be made available to food insecure families in all regions of the Commonwealth. Well, we are excited to say that DARS will be rolling out a nutrition education service standard to be implemented statewide in federal fiscal year 2022. It's in draft form now, and it's making its way through the approval channels. Another one of DARD's nutrition services that align with the roadmap to end hunger is the AAA's provide one-to-one nutrition counseling services by registered dietitian nutritionists. And DARS is excited that this was implemented in October of 2019. The need for nutrition counseling is triggered from a nutrition assessment where participants score as high risk on the nutrition screening instrument and answered yes to the following question. Without wanting to, I have lost or gained 10 pounds in the last 6 months. And that triggers the need for nutrition counseling. Moving on to the Senior Farmers Market Nutrition Program. I administer that program at DARS. This is a wonderful program that provides low-income seniors with checks that can be exchanged for eligible foods at farmers markets and roadside stands. The purposes of SFMNP is to provide fresh, nutritious, unprepared, locally grown fruits and vegetables and herbs from farmers markets and roadside stands. This is an annual USDA grant, and it runs June 1st through Thanksgiving. It's in 11 areas of the state. 10 AAAs participate and 1 city, the city of Emporia. So we had, this year, Virginia had $400,013 about in food funds for 2020, and we served over 10,000 seniors. We also have cooperative agreements with the Department for Agriculture and Consumer Services. They provide the engagement with the farmers, farmer training, farmer monitoring. We have a cooperative agreement with the Department of Health because we also have the WIC Farmers Market Nutrition Program, so they are instrumental in the link to WIC. And as I mentioned, we have an agreement with the city of Emporia. So in SFMNP, our redemption rate in Virginia is very high. Last year in 2019, it was at 85%. The regional redemption rate is at 81%, so we're higher than Maryland, New Jersey, Pennsylvania, West Virginia, Delaware, DC, and Puerto Rico. And the national redemption rate is at 79%. So we consistently have higher than regional and national rate averages, which is always great news, great participation. In 2020, our redemption rate is on track to equal or exceed last year, even in the midst of the pandemic. We have 207 participating farmers, 62 farmers markets, and 31 roadside stands. And all these numbers increased greatly this year. Last year we had 24 roadside stands, for example, and it's up to 31. And we had under 200 farmers. So it continues to grow every year. Some of the COVID pivots this year for this program included curbside pickup, online ordering, aggregate and drop off at senior housing facilities using the building's manager as a proxy. And that contributed to keep our rates consistent because a lot of other states are dealing with lower redemption rates. So this screen here just gives you a snapshot. Virginia, as I mentioned, this program is only in 10 of the 25 AAAs. We get funding from USDA only, and they assess our performance by what our food grant utilization is. So although Virginia has a high redemption rate, we return any unused food funds that weren't utilized. As compared to other states that have state funding, they can spend and utilize 100% of the federal funds that would get used first, and then maybe rely on a little bit of state funding. So how can we align SFMMP with Virginia's roadmap to end hunger? We can expand the senior and WIC farmers market nutrition programs statewide. We can increase the number of senior outlets in Virginia from 10 area agencies to 15 area agencies, serving high need populations. We can increase the number of farmers and farmers markets throughout Virginia and expand from the 5 growing VDEX regions to the total of 6 growing regions. So what that is currently one entire region represented by VDEX is not included in SFMMP. So we can increase the number of authorized growers in the areas identified as food deserts, and WIC and senior farmers market nutrition programs should be available to all highly accessible high-need farmers markets. So one barrier that we struggle with is for VDEX, the Department for Agriculture, currently does not have enough staffing to move into that 6th region. Another statewide program I want to just bring attention to is Virginia Fresh Match. It's a statewide network to help farmers markets serve low-income shoppers. These incentives double the value of the federal nutrition benefits like SNAP and increase consumer purchasing power so individuals and families with tight food budgets can bring home more Virginia-grown fruits and veggies. Farmers markets are on the rise in Virginia with more than 250 locations selling everything from peas to peaches. Half already accept SNAP, but while Virginians spend over $1 billion each year in SNAP, only 0.2% goes to farmers markets. When more SNAP money is spent on local produce, everyone would benefit. So aligning Virginia Fresh Match to the roadmap to end hunger, Virginia Fresh Match and the WIC and Senior Farmers Market Nutrition Program will be available at all highly accessible high-need markets. This is the wish of the roadmap. So currently there are 79 SNAP authorized markets that work with Virginia Fresh Match. And of those 79 markets, less than half of them also accept the Senior and WIC Farmers Market Nutrition Program coupons. So there's an opportunity for growth. Another federal program is our SNAP Outreach Program. Currently, 4 AAAs participate in the SNAP Outreach Program in Virginia, which is run through the Department of Social Services. What is SNAP? SNAP provides nutrition benefits to supplement the food budget of needy families so that they can purchase healthy food and move towards self-sufficiency. In 2020, there's 4 AAAs that contract with SNAP, which is down from 5 AAAs in 2019. And for 2020, the funds received from the Department of Social Services was $51,800, down from $81,400 in 2019. So this outreach program provides assistance with eligibility pre-screening application. It promotes SNAP in the community events, senior centers, senior living, and this outreach is provided by care coordinators generally. So how can we help align SNAP with Virginia's roadmap to end hunger? The SNAP participation rate will reach 90% of eligible individuals or higher. So currently, the rate of SNAP participation is 75% for Virginia seniors. So the goal is to raise that by 15% in the next 5 years. So we could also increase the AAAs that participate as SNAP outreach service providers and promote the program to more AAAs. So another federal program in Virginia is the Commodity Supplemental Food Program, or CSF. And that's run through the Department of Agriculture and Consumer Services. It works to improve the health of low-income older adults at least 60 years of age by supplementing their diets with nutritious USDA foods. So these low-income seniors are at risk for malnutrition. It currently serves its maximum caseload of 10,800 people. And it provides supplemental food recipes and nutrition education, and it's administered through our statewide food banking system. And currently there's 3 AAAs that participate in this program out of 25. Recipients may pick up a box at their local food distribution center or arrange for home delivery. Each box has a retail value of $40 to $50 and will contain items such as protein foods, pasta, sauce, oils, flour, canned and fresh fruit, canned vegetables, ultra high temperature milk, cereals, rice, and more. So to align CSFP with Virginia's roadmap to end hunger, we could advocate to get the caseload expanded. And once that caseload is expanded, we can connect more of our AAAs to CSFP distribution sites. Another federal program is the Child and Adult Care Food Program. CACFP is run through the Department of Health. It provides year-round supplemental federal funding to eligible adult care centers, child care centers, family daycare, Head Start, at-risk after-school care, and emergency shelters. This funding is used to provide nutritious meals and snacks to lower-income participants in these care programs. And currently, there's 4 AAAs that participate in the CACFP. 3 of them provide this service and 1 contracts it out. And there's 37 adult daycare programs that utilize CACFP. So how do we align CACFP with Virginia's roadmap to end hunger? We could provide outreach and program information on CACFP to the adult daycare providers through the AAAs. And the last federal program I'm going to touch on is TFAP, the Emergency Food Assistance Program that is operated through VDACs. It helps supplement the diets of low-income Americans, including older adults, by providing them with emergency food and nutrition assistance at no cost. It provides food and administrative funds to states to supplement the diet of these groups. And it's run through food banks who distribute to food pantries, such as churches and distribution centers, as the distribution centers, and also soup kitchens. To align this program with the roadmap to end hunger, Virginia's will have streamlined access to food security information and benefit programs. And we at DARS can ensure referral programs to the AAAs include information on how to access this program. So circling back, a few summaries, recaps, and takeaways. The roadmap has a top 10 list of goals that they would like to obtain by 2025. And we can help advance the federal programs that we administer to align with Virginia's roadmap to end hunger. And so a few of the takeaways, as mentioned, were that home delivered meals for seniors and people living with a disability will be provided as a Medicaid covered service. Evidence-based nutrition education programming will be made available to everyone in the Commonwealth. The Senior Farmers Market Nutrition Program, along with the WIC and Virginia Fresh Match programs, will be available at all highly accessible high-need farmers markets. SNAP participation rate will go up from 75% to 90% of anybody who's eligible. And Virginians will have streamlined access to food security information and benefit programs. And there's my contact information, and that was a lot of information to throw at you all at once, and I was wondering if anyone has any questions I might be able to answer.
Thank you, Kelly, for that presentation. I really do appreciate the information. This is Harvey Chambers. You had mentioned that the Senior Farmers Market Nutrition Program was your favorite, and I can see how that is based on what we know about those canned goods and things that go out to seniors and the high sodium levels in those. But I was wondering, in some of these programs that you mentioned, you had some participation with some AAAs, but not all of them. Can you give me an idea of what may be some of the barriers to having the AAAs participate in some of these programs? I'm on the advisory committee for Senior Connections here in Richmond, and I was just wondering what would keep the AAA from maybe not participating?
That's a great question. A few that come to mind right away is even like they might not even know that they could be involved in them. For example, but CSFP has already maximized their caseload, so they have no more wiggle room to work with more AAAs at this time. So money a lot of times is a barrier, funding. Those are two quickies, and maybe staffing, maybe they're challenged to have the staff capacity to be involved in these programs.
I'm going to have a couple more questions to get at. This is Harvey. I'd like the fact that some of these had opportunities to actually have these delivered to their homes. And in one situation, I can't remember which program you said that they were actually like delivering to senior communities. And so I know now with COVID, there's a lot of drive-through distributions that are happening as well. But I'm just really interested in possibilities to be able to expand that to make sure that it's accessible for people that may have a transportation barrier. So that's just something that I'm curious about, is make sure we can look at that option as well.
And the great thing is AAAs already have transportation systems in place for their home delivered meals. So as long as they have capacity to grow their transportation, this is something that could all be worked on and looked at, and this committee may be able to help with to make sure all these programs are maximized in Virginia. And
then this is Harvey again. One final thing is I'd like the home delivered option being covered through Medicaid. I work in Anthem, I work in our CCC plus population, and I think it really would be good to be able to kind of align that as one of our benefits, to those older adults that are on Medicaid, to make sure they're getting those meals. So again, thank you for that as well.
Yes.
Hi, this is Erica, and thank you for that excellent presentation, and that lays out so clearly how we can align with the roadmap, and that seems like exactly what we need. I wondered if you could talk a little bit about disparities in food security and food deserts and sort of equity and inequality issues throughout the state, and how we could best target these resources to those in greatest need.
That's a great question. I think what I'm going to do is hone in on the Senior Farmers Market Nutrition Program that I'm heavily involved in, just to give you an example of what I have seen firsthand going on there. So in looking at the entire state of Virginia, in the Chesapeake area, there are and this has been studied, it wasn't studied by DARS, but there was a map of where the food deserts are. And in Chesapeake, there's 7 food deserts. So very high need areas there. And so we'd already have our SFMP program in that area, but we're really struggling to have farmers that grow enough of their own product that participate at farmers markets and participate in the SFMP to sell. So one of the challenges, and these are federal restrictions and some state restrictions, is that one of the requirements to be a farmer in that program is you have to grow your own produce. That's it. That's all you can accept the coupons for. So a lot of the farmers on that side of the state are supplementing what they grow. Say their specialty is watermelons. They're good at that. They grow good on the southeast side of the state, but they supplement with other foods like that they purchase at wholesalers that makes those foods ineligible. So you have a participant that comes with a check in their hand, and all that the farmer can give them is watermelon when they see this beautiful kale that they want, for example, and they can't offer that. And then that participant gets frustrated with the farmer because they think they're being denied that. So I can't speak specifically to the whole state on disparities. That's just the one example I see, is that there is some, where there's a high need, I feel like I'm struggling to get the program for senior farmers market solidified in that food desert area. I had someone reach out to me that's trying to create a food hub in that area, but I can't get what they're doing with the food hub to align with the federal guidelines of SFMNP. So I didn't totally touch on what your question was, but I just wanted to give you that one example that we've been working on.
I cannot, it seems so complicated with all these different programs with different requirements. So I can see how that in and of itself might be a barrier and might prevent the kind of disparity focus that we might need. I had one other question, and that has to do with the expanding the home delivered meals to get coverage through Medicaid, which seems like a terrific idea and something that should be supported. But I wondered how that would work. So we have Older Americans Act funds now going into the home delivered meals. And so how would those two pots of funds work together to expand it?
That's a great question. And you are going out of my area of expertise a little bit. I know my colleague and fearless leader, Kathy Miller, is on the call. She might be able to touch on this. Kathy?
Erica, could you tell me again what your specific question was?
Yeah, I'm just trying to picture in my mind. So we have current funding for home delivered meals under the Older Americans Act, and that's great. And so the idea under the roadmap would be to get increased coverage through Medicaid, to get an increase by having Medicaid cover home delivered meals, which seems like a terrific idea. I just wondered then how those two pots of money would work together. What would happen to that money, that Older Americans Act money that had gone to home delivered meals? Would that then go to congregate? Is it moving around the pots, or how does that work?
Well, it's, the Medicaid money is state money.
Mm-hmm.
And so we have had discussions in the past with DMAS and some of the AAAs, because we were trying to see if Medicaid would be willing to include home delivered meals. And there was a lot of discussion, but we didn't really come to any resolution on that, because there are the barriers versus, with the Older Americans Act being federal money and the Medicaid program being state funded. So in order to do that, we would actually need additional funding through the General Assembly to be able to provide that. And then Charlotte, I know you worked at DMAS. You might have some insight into that as well. But at this point in time, I would say that without additional funding from the General Assembly, we're not going to be able to accomplish that.
Yes, I would definitely emphasize what Kathy Miller has already said. There are a few states, I believe either Oregon or Washington comes to mind, that do provide home delivered meals as a Medicaid service. And I'm not sure if it's specific to the waiver population or the general population. But we can definitely look more into this topic. I know we have also seen, and I don't know if Harvey could speak to this, but some both Medicare and Medicaid plans that voluntarily provide home delivered meals sometimes like up to 7 days or 14 days after a hospitalization. And I don't know if Diana knows about that or Harvey, but I don't know specifically in Virginia who those are, but I've heard about that in Virginia and in other states.
Yes, this is Harvey. So yes, there are some managed care organizations that do offer home delivered meals after a hospital stay for the first 7 days. But there is some criteria that's associated with that. And from a managed care standpoint, that there are some barriers to that. So it's not something that it's open access. Anthem is one of those that does provide that. So it would be, if we were looking at this, just like with the adult dental, it's just something where if it's a blanket situation, then you have all of the Medicaid recipients would be eligible for that, and not have it kind of carved out to a certain demographic of that managed care organization's members. Did that answer that?
I think that helps.
Yes.
Diana, did you?
Yeah, it's some of the insurance carriers like United Healthcare, Humana, and Aetna. After you have been in the hospital for a few days, they will send to your house frozen food up to 7 days, and that is what you had to be in. You have had to be in the hospital in order to get those frozen food.
Yes, this is Kathy Miller again. There are some that would be a benefit, an enhanced benefit under the Medicare Advantage plans. And as Harvey said, that there are criteria. Not everyone who is a member of those plans is eligible for all of those benefits. So, it would be nice if it were universal coverage, but it really is limited to certain participants.
I know Medicaid in Virginia, DMAS, is working right now actively on developing what they're calling a high needs support benefit. And that is for housing supportive services and employment services, supportive services. So Medicaid cannot pay for housing, room and board, or anybody's rent, but they are developing and sort of sketching out this framework for services to help Medicaid beneficiaries identify housing options, stay in their housing, help minimize evictions, and then also for employment, also to help them find jobs, stay in their jobs, might help with transportation to their jobs. So that's the high needs support benefit. And, there might be that they're going to need to seek funding from the General Assembly for that service in the next year or two. But that high needs support benefit model might be something to look at here in terms of the home delivered meals. Because with the high needs support benefit for housing and employment, you also have to meet certain criteria. You either have to be housing, have instability in your housing or job interruptions. And there's a screening process that's being developed for that I imagine would be the case if there was going to be down the road home delivered meals benefit in Medicaid as well. And I think, as Kelly has touched on today, there are some screenings and tools out there to identify if somebody is food insecure or at risk for food insecurity or malnourished. So we can look at some other states and see maybe how they've operationalized this in terms of your question, Erica, with how does the Medicaid benefit interact with the older Americans?
That would be helpful. I'd really like to see how that's handled in other jurisdictions.
And this is Harvey again. Thank you, Charlotte, for sharing that. I think that might be a good angle to approach because, yes, with that high needs support group, we've already kind of screened and we've identified who falls into that category. And so it may be if we're going to ask for funding that we put a screener or something in place to specifically identify those individuals that would benefit from this.
And this is Kathy again. I can go back and look at what issues were raised before when we looked at this, because, I'm assuming that the AAAs could easily become Medicaid approved providers for home delivered meals, because in the past they have been Medicaid approved providers for personal care services. So, it is possible, but I will go back and try to get some information on where the roadblocks came up before.
Thank you, Kathy.
This is Erica. I want to go back to Harvey's question about the AAAs and the barriers and why more AAAs are not participating in all of these various programs. And I wondered if there's any more specific information. I mean, several barriers were named: staffing and money, and they don't know about the programs. And I wondered if it would be possible, or if it has been done, to ask them, to survey them as to why, so we could better pinpoint the problem, because it seems like the AAAs are a key mover and shaker here. And if we could get them on board, we could do some of this aligning.
I'm sure Kathy agrees with me on this. We are happy to survey the AAAs to find out what the barriers are, and that will help us build the work plan, how we want to move forward and increase the participation, et cetera.
That would be great.
Yeah, and this is Kathy again. It is interesting that we used to have more AAAs that participated in the SNAP outreach program through DSS. And so I'm kind of surprised that I think at one point we had 9 or 10, and now we're down to 4. So as part of our survey, we can ask them why they stopped participating.
Is that because of lack of volunteers?
I'm thinking it may have to do with not enough funding or lack of capacity on behalf of the AAA, because the funding for the AAAs has been relatively flat over the last decade, and the AAAs are being asked to do more and more, serve more beneficiaries or more older adults as the population continues to grow on the same amount of funding. So sometimes their resources are really stretched. And then especially now with the pandemic, it's been even worse. Whereas they've lost some volunteers because the volunteers may have been older and they felt that they were high risk. And so they didn't want to volunteer right now. But then they've taken staff and moved them from, let's say, if they were working in the congregate meals program, when they closed the congregate sites, then they put them out delivering meals. So they've had to, as Kelly said, they pivoted kind of quickly to figure out how they could, basically reposition staff to try to pick up some of those duties that the volunteers were doing in the past. But staff capacity is a problem really across the board, I think, for our AAAs.
I think it's a good segue into the next part of our agenda, which was to kind of discuss the programs that were presented and information, as well as what sort of next steps or recommendations you might want to kind of move forward on. And some of them might be a longer term discussion than what maybe we're prepared to act on today. Are there any, I think Kelly and Kathy are still going to stay with us, but are there any specific questions about Kelly's presentation at this point?
I have one. I'm sorry. Hi, this is Carla. Kelly, that was an excellent presentation. Thank you so much. I have a question about the, and maybe you addressed it, the farmers markets. So if I understand correctly, the farmer can only sell what they grew. So even if they go to an area, let's say like Rockingham, that has that big, I think it's Rockingham or somewhere in the Shenandoah region, where they have that huge farmers market, where I know, at least in Virginia Beach, people do go, some of our farmers do go up there to supplement this. The product is still grown in Virginia, but it's not grown by that particular farmer. Those foods can't be sold within, for that farmer, even though it's grown in Virginia and it's brought into, but the farmer himself didn't grow that. That's still not allowed.
That's exactly right. Now that's just for the Senior and WIC Farmers Market Nutrition Program. That's a state regulation that could be looked into. It's going to take, agreement with the Department for Agriculture. But you're absolutely right. So that wouldn't be eligible. So there is a lot of limitations. When the program was implemented, and especially I think in Virginia, when the teams were looking at building this program, we were trying to help the small farmer that's just growing some items and bringing it to the farmer's market. And so they're trying to expand on the sense of community at a farmer's market and helping the small farmer. But it is hard the small farmer is struggling to compete with bigger farmers standing next to them at the farmer's market that has this huge variety that doesn't necessarily accept the coupons. But the participants are coming because they want to see a variety. It's like going into the grocery store when you see that huge variety in the produce section. Participants are looking for that. And so when they get limited and a farmer has to say, sorry, you can't have that, but you could have this, that's just specific to Senior and WIC Farmers Market Nutrition Program and could be looked at.
Yeah, I mean, it's a great program. I'm more familiar with it in West Virginia, where I know people that use it. I live in Virginia Beach. I'm not sure that our biggest farmers market, which is the Old Beach Farmers Market, as well as, I'm not sure if they accept them. And I'd be curious as if there's a listing of who accepts them, who doesn't accept them, because there might be some outreach there. Because I know, like, at least with Old Beach, they have and also does it go over not only for produce, but for meats and sausages and eggs, if the farmer grows those and butchers it themselves?
Senior and WIC Farmers Market Nutrition Program is only for fruits, vegetables, and fresh cut herbs.
Okay,
So,
thank you.
Yeah, that is another barrier. If you raise your own eggs, which, eggs are a wonderful food item, but this is specific to produce.
Okay. All right. Thank you. Thank you. That was a great presentation. Thanks again.
And great questions.
Any other questions? I don't know if it helps to guide the conversation. It's 11:05 today, right now, and we have till 11:30. I did put together a couple of handouts for you. One is the potential work plan, at least for today. And then the other was kind of a template for potential policy options for how to conceptualize what the group would like to do, over the next year or so, in terms of recommendations or further research. Have you had a chance to kind of look at that, or? Mm-hmm.
Charlotte, this is Erica. I really like the template, and I wonder if one of our next steps could be to expand it. This is obviously just a start, and Kelly laid it out so clearly that putting it here in terms of short-term and long-term and ongoing, and putting down the ones that Kelly mentioned, and then any, adding any that we might have, seems like it would structure our discussion pretty well.
Okay. That does remind me, and what I can do is I'll pull this document up, and if we want to kind of work through it, we can. The other resource that was suggested for the members today was the Defeat Malnutrition.today website. A former Council on Aging member, Bob Lancato, was involved in the development of, I believe, that initiative, and also involved in modifying the Council on Aging scope to include a focus on malnutrition in older adults. And so the Defeat Malnutrition site, the two other suggestions that we haven't touched on in Kelly's presentation that came up, that sort of stood out to me from that website, were one, to potentially get a resolution or a proclamation recognizing October as the first week of October as Malnutrition Awareness Week. Some states have done that. And then the second one was looking at ways to expand screening for food insecurity. You've heard about how Kelly talked about how our meals participants in the Older Americans Act program are screened for food insecurity. The site recommended, looking at ways to provide screening to more older adults, and here it would be in Virginia. So I just wanted to highlight those. And then lastly, just you heard a little bit about the COVID response from the AAAs over the last year. It's been really remarkable how quickly DARS has supported them in getting that funding out. And Kelly's right, DARS was one of the first states to get that money pushed out to AAAs when they desperately needed it. And they continue to provide that support. So I think it would be appropriate for the committee to continue to kind of keep an eye on the COVID response and funding and ways that we might need to continue to address food insecurity as this pandemic drags on quite quickly. Let me pull up.
Could we add, Charlotte, those items that you mentioned, the two from Defeat Malnutrition and the tracking of the COVID, could we add those into the template as additional?
They're there.
Okay, they're there.
Mm-hmm. They're in here's the, I don't know if can you see my Word document?
Yes.
Yes.
Okay. So that's these three here. And then that I just mentioned. And then the first row has a few selected items from the roadmap to end hunger that relate to our work and what the roadmap suggested. I think we try to break them up into what might be more short-term and long-term. And that, is sort of a relative term right now when you think about the state of the budget in Virginia, and now that we're coming up on a new General Assembly session.
So each one of these items in the roadmap is pretty daunting. And it might be useful to expand each one into a separate item, or so that we could focus on the different priorities because they all seem so important. Just sort of expand that a little bit so that we could clearly see the different options. I think it's a great template.
You want to add?
Yeah, another one. Yeah, just like put the line, in other words, research AAA participation in the commodity. Those are all seems like separate things. And I know they all come from the roadmap, but they're very separate programs. So I just wondered if we could flesh those out a little bit more, I guess.
Okay, so these are just a few of the examples. So if you want to tell me what you want to add.
Okay, so let's see. I see what it is. I guess, well, maybe it's a different template. I guess I was thinking of each of the policy, a template where you'd have each of the policy recommendations and then the kind of the flesh it out with either the steps or the key the key statistics, so that
yeah, I don't think I'd gotten that far.
Right. That might be a next step.
And it might be something to think about, developing kind of a larger document with, an array of recommendations, but also kind of honing in on which ones, a few that you might want to focus on, and that can be done either administratively with DARS, like this, doing a survey of AAAs, or that can be done at no cost, like potentially this resolution or proclamation, and then what things are going to cost money, like the farmers market or the home delivered meals and Medicaid. And, thinking about over the next year, with the budget constraints that we have, what you might want to move the needle on in that regard.
And one column could also be whether General Assembly action might be necessary or not. Looking at it from the point of view of the Legislative Committee, that committee would want to know that. And I guess the other one would be research, looking at what other states are doing and so on. Or maybe that goes back to legislative.
And we might see some things. I think one of the things that aligns well with the group today, the convening of this nutrition special committee, is the release of this Virginia roadmap to end hunger, which has been signed by the governor. It was developed with an interagency work group and stakeholders, correct, Kelly?
Yes, through the Children's Cabinet, there was the Food Insecurity Work Group, and that's where it was born.
Yes, and so here it says too, the input from the governor's Children's Cabinet, feedback from regional town hall meetings, and contributions from nutrition and food security working groups. So it would seem to suggest that, more than suggest, I think this is a clear indication of this administration's interest in working on these topics. And so we might see some additional work coming out of this over the next few months, with the General Assembly session coming up, and obviously with the news that we're hearing about the dramatic rise in food insecurity across the country and in Virginia.
Charlotte, this is Carla. I think Erica mentioned, I think this may be overlapping with what Erica talked about with research, but just, investigating best practices with other jurisdictions.
Okay, yeah, we can definitely.
Thank you.
Mhm. I think this is going to be, this would be the survey that we talked about of AAAs we can work on, but that doesn't have to be a long term. And then I think Kathy was going to look back at the Medicaid
Yeah, the
delivered
Medicaid
meal
review.
discussions.
Yes.
Mhm. Oh, the other thing that is on here that we didn't discuss and is in the roadmap are some is recommendations related to better linking people who need services, who need food supports with those supports. And so they've created this feedva.org website. And I think there are some opportunities, to align that with No Wrong Door initiative and make sure that our No Wrong Door is synced with that and they have their synced, because people might also come looking for food and then find they need actually some other stuff, whether it's some in-home supports or transportation. So I think that's something we can look into as well.
Excellent. That was my question as well. I'm sorry, this is Carla again. Is how do I think as more seniors are going to fall into this category, how do we let them know?
Mm-hmm.
Yeah, this is Kathy. I was just going to say, I think, Charlotte, you're talking about Direct Connect.
Yes. Mm-hmm.
With No Wrong Door. Yeah.
Mm-hmm. So I don't want to rush anybody, but I'm trying to be conscious of the time. So it's 11:18. Wanted to throw out to you how the committee would like to proceed next, both in terms of meetings and activities or recommendations, deliverables, and start to see where we want to go from here and how can staff best support that.
Well, just in terms of timing, as far as next meeting, I'm looking at the calendar that you laid out here, Charlotte, and I'm conscious that the legislative committee will meet in July sometime, and it might be beneficial for this committee to meet sometime before that. So if it's necessary to feed into that, we could.
Yes, I think that seems very logical. I think for some of these, if we were going to go back as an agency and look at how to do some of this legwork to support you, I think probably would help to have us some time to do that, where, as you know, we're getting into the holiday season and then the General Assembly session. So potentially, looking at maybe pulling this group back together in March or April, I'm thinking might be work for us.
I think that's a good plan, since we do have a meeting scheduled for April.
So maybe, and then you could maybe report out on some things at the April meeting.
Yeah, I think so.
And so then maybe in April or definitely by July, we could have some more tangible things to put before the council.
If one of our goals is to work on Malnutrition Awareness Week in October, the timeline would be good for that.
Mm-hmm.
This is Erica. I just had one more thought, and that's that it's just so wonderful that we now have the Medicaid coverage of adult dental care, and it might behoove this committee to just track how that plays out and how it's implemented and what the coverage actually is, because that's so closely related to and directly affects malnutrition. That's out of place. I should have brought that up earlier, but it's just another factor here.
No, that's great, Erica. And I believe that starts to go live January 1, correct?
July is what I
July. They
thought.
moved it to July. Okay.
Yeah.
So yeah.
Hey, Charlotte.
And I can,
this is-
as those, you know, if we're hearing about that dental benefit, I'll definitely share that with this group and the council as well, because I know that was a recommendation.
Yeah.
Kathy, I think you were saying something. Or-
Yes, I'm sorry to interrupt, but while we've been talking, a notice just popped up that ACL and CMS are going to have a combined webinar on reducing food insecurity among Medicaid home and community-based services beneficiaries on January 14th.
Wow.
So
That's very timely.
yeah, so I can forward this to you, Charlotte, if you want to share it with the community committee members and they can register.
Yes, I think that'd be great. And that might be helpful to me as well, because I'm sure they might talk about what some other states are doing, and that can give me sort of a jump start on that.
Right.
research.
I mean, it was kind of amazing that it popped up just now.
This whole thing has been very serendipitous, because when Kelly and I first got together to talk about this group and how to move forward, it was also either that day or the day before, the day after that, this roadmap came out. So I think the timing of this has all been quite fortunate in terms of this council's interest in this topic. Okay, so it sounds like obviously we'll be sending some follow-up materials out to the committee, including the PDF of Kelly's PowerPoint, which was so wonderful. And Kelly, thank you for that amazing presentation. I think it was really informative for me, and I'm pretty sure it was informative for the members as well. And we'll look to set up a meeting perhaps before the April 28th council meeting. So maybe in late March, early April at the latest, to kind of review what we've pulled together and some potential ideas for the committee to consider. We'll also send out the webinar that Kathy mentioned, in case you'd like to join that. And usually they also archive those. So if you can't make the live one, usually if you register, they'll send you how to watch the recording.
Right. And it does say it will be recorded.
Is there anything else that anybody can think of that I may have missed?
I would just like to thank you, Charlotte, for bringing all this together. Excellent, excellent summary of everything that we've discussed in the past, and a roadmap for where we need to be moving.
Yeah, no problem. Thank you. And like I said, Kathy and Kelly have been really great to work with their expertise too. Any last minute things we want to discuss? Okay, if you have any other thoughts, feedback, things that come up, definitely feel free to send those. We'll kind of build out this template a little bit more with some of the characteristics that Erica was suggesting in terms of budget, legislative, those types of things. And we'll prepare some more materials for you well in advance of your next meeting. And if there's anything else in the meantime, like other webinars or briefs that come out, I'll definitely shoot them your way as well.
Thank you so much.
Thank you so much. Thank you so much.
Thank you all.
Thank you. Thank you.
Yes, no problem.
Thank you,
Diana,
everybody.
as chair, would you like to adjourn the meeting?
Meeting adjourned. All in favor?
Great work. Thank you all. I hope you have a really good rest of the week.
Thank you. You as
Happy
well.
holidays.
Happy holidays, everyone.
Happy holiday. Happy Merry Christmas.